Connecticut Parent Advocacy Center, and I am the transition coordinator. And tonight we're lucky to have Beth and Lois with us. But before we get started, I just want to remind everybody that this is being recorded. So just be mindful of the things that you say and any personal information. This is a longer session with a lot of information. So if you can put your questions in chat, we will try to get to them. But if there's something that we do not get to, please email us or call us and we'll be happy to discuss it with you. And at that, I will turn it over to Beth and Lois.
Good evening, everyone. I'm excited to be here on behalf of CPAC. My name is Lois Eldridge, and I am the Youth Advisory Board Leadership and Training Coordinator. I work with Laura on many transition activities.
I'm Beth Reel. I will be talking with you a little bit later, but I'm just going to jump in and introduce myself now. I'm co-executive director of the Connecticut Parent Advocacy Center and also very much involved in the transition team at CPAC. So welcome, everybody. Anyway, Lois.
As you saw in the flyer that advertised this wonderful Transition Tuesday session, ACCESS is an acronym for Achieve, Context, Choices, Employment, Support, Success, Transition. And the goal of this evening, as we mentioned, is to have an informal workshop on how to navigate the system of services that assist individuals with disabilities in Connecticut. This PowerPoint is a presentation that includes a lot of information, and for tonight's purposes, we will briefly overview approximately 24 agencies and their services. I spoke with Jill Larmette, who is an originator of this presentation, and originally was a day-long training for educators and service providers. And for the 90 minutes that we are together, we would like to review some of the information, but obviously we can't go in depth, but we're going to do our best to guide you in the direction of services that may support your loved one, your youth, or your family member. Jill has asked me to remind you that this is a while you're waiting sort of PowerPoint and presentation. Some of you may know the services that your child, your youth, your family member already are eligible for, but there may be some activities that you could do while you're waiting for services. So we have approximately 90 minutes. Let's begin. So let's talk about self-advocacy. Although post-secondary education students with disabilities are entitled to certain protections, the process for accessing accommodations is much different than high school. Youths must take a more active role in knowing their rights and advocating for their needs. This means they must know about their disability and the accommodations they need to be successful in school and in the workplace. Families play an important role in helping their youth learn self-advocacy skills as well as their rights as a person with a disability. So why is it important to be a self-advocate? Who's responsible to teach self-advocacy? Well, the answer simply is everyone. Everyone, parents, teachers, schools, personnel, students, and honestly, siblings, as far as I'm concerned. And why is it so important? If you want school relationships, post-secondary education and training, employment, community, and independent living to be successful, then individuals with disabilities simply need to understand their disability and the needs that they have to be successful. So where is it taught? At home, at school, and in the community. So the Americans with Disabilities Act was created in 1990 and it is a federal civil rights law which protects people with disabilities from discrimination in the areas of employment, public accommodations, state and local government services, telecommunication, and transportations. Employers may not discriminate when it comes to hiring individuals with disabilities. There is more information that you can discover by following the link to the American Disabilities Act, and it will also tell you information that may be helpful if your child or your loved one is currently working and you feel as though they may be discriminated against. One of the accommodations that is a very simple accommodation is changes in the workplace to accommodate a disability. So before you, you see several slides of typical accommodations that you might see in the workplace: large screen, a sign interpreter for the hearing impaired, a wheelchair desk. You may have various beginning and end times, a flexible schedule. These are some of the accommodations that are maybe based on an individual's disability. Job Accommodation Network is a wonderful resource for individuals. It's a very easy tool to use when determining what accommodations are afforded to a person with a disability. For example, if you opened the resource and you looked up under disability, which is listed A to Z, for example, if you had epilepsy or seizures, and then you go to a career, let's say as a dishwasher, Jan will list all the accommodations that are afforded by Americans with Disabilities Act that you can ask your employer for, which may be as simple as a rubber mat to stand on while you're doing the dishes in the event that you may entail a seizure. These are all appropriate accommodations that you might ask for at a workplace. I encourage you to check it out. If your child, loved one, or family member is in a school service, they certainly should be available and looking at this resource. One of the biggest questions around Americans with Disabilities Act is, should I disclose or should I not disclose? It's a very big question. Persons with a disability should advocate for what they need, but we often hear that it's unfortunate that if they don't advocate and they're not successful at a job, there is no protection for them. This is a question that a person should never there is a question that a person should never disclose. It's something that there are pros and cons, and there is practice interview questions that you could find in the resource that you see below that's titled 411 on disability. That resource will help guide you as to whether disclosing a disability is appropriate for you. So for example, if you came into a job interview as a travel agency and you're in a wheelchair, you don't have to disclose that you have a disability. It's a clear and obvious disability. However, you may want to mention that you travel all the time, that you have a full passport, and prove all the things that you can do as a travel agent in a wheelchair so that there's no bias. But whether you disclose or don't disclose is simply an activity that you have to determine what is best for you. I encourage you to look at the 411 on disability disclosure for adults.
Okay, thanks, Lois. So we won't go into depth of Social Security and some of the other benefits because these Social Security in itself is a whole presentation on its own. And we do hope to bring somebody in to talk about benefits in the future because it's something we get a lot of questions about. But what we do want to touch on is the fact that if you do receive Social Security benefits, you can still go to work. And so there are programs that are available that can help support somebody who receives Social Security and other benefits, particularly health benefits, that can help people to retain those benefits while going to work and earning more money. And so you can still go to work and receive Social Security benefits. You may, in the long run, be better off going to work than receiving Social Security benefits because you could make more money and not live at the poverty level. And if you go through some of these programs, you may still be able to receive your medical benefits. And so on the next slide, Ticket to Work is information about that one particular program that can help people keep their benefits while still working with service providers to receive support to get a job, perhaps training and other information that might be needed, and other employment supports. So this is a video. There's two links. One has the second one has ASL, and I encourage, we're not going to take the time right now to watch them, but I do encourage you to watch the Ticket to Work videos because they can give you some good general information about the program. And the best way to learn more about how to go about keeping benefits, Social Security benefits and medical benefits is to work with the Bureau of Rehab Services Benefits Counseling. They are the ones who know this is a very complex program, and they are the ones who know all of the details. And I cannot remember if we have we do have the information later on, Laura, in the...
We do, and this entire PowerPoint, there's a lot of hyperlinks, and the benefit counselors are hyperlinked.
Great. So that's probably in the section on BRS and aging and disability services.
Beth,
So
I'd like to just add that the benefits counseling for BRS is a free service. So I encourage folks, whether you're considering Ticket to Work as it relates to Social Security, or find out any other information that you may need to be reporting or paying attention to, because benefits for an individual with disabilities is complex. There are many. They're timely reporting, and they are very, very good at guiding you through the process based on your family member or your youth's age. So I encourage you, I can put their phone number in the chat if that's helpful.
That would be great, Lois, because it's really an important resource, and I highly recommend that anybody receiving Social Security disability contact them when considering moving forward into the workforce. Let's see if there's anything else I want to say about that. Nope. Okay, next slide. Okay, so now we will talk about some of the state agencies that offer employment services and how to connect with them and navigate through. So American Job Centers is a overarching sort of an umbrella of a lot of different services and agencies and organizations. So what people may recognize the logo. There are, I think, 5 there. It's on the next slide, but we're not ready to go there yet. Centers in Connecticut. It's formerly the Connecticut Works Centers. The name has been changed for several years now. And they're considered one-stop centers. And so these centers are for everyone, not just for people with disabilities, but they also offer services for people with disabilities. It's through the Department of Labor, and they help workers find jobs for free. They help with assessments to find what jobs might be the right fit for people. They have resume help, interviewing help. One of the benefits that I think is interesting is if there are training programs that are paid for through the federal government, which could be anything from a training program to improve skills or a training program to earn a certification that might then lead to a job. The American Job Center knows about those programs and can connect people. They do offer services for people with disabilities. One of the things I do recommend, just on a personal note, as a person who has walked through the door with a person with a disability, is it might be a good idea to call the center that you are going to visit beforehand to ask them questions, and if there's a particular person that they should speak with when they get to the center, because sometimes the person who offers accommodations and support might not be working that day, or might work different hours. So it's a good idea just to give them a quick call and connect with them. These centers are open to people who are over 18 and are allowed to work in the US. And most of the time, with the exception of needing specific accommodations, there are things that you can find right there as when you walk through the door that can help. It's recommended that you go to cthires.com, which I think we have a couple of slides later. So sorry, I'm jumping around, and register before you go. But if you can't do that for some reason, then you can also register when you are there at the American Job Center. So these are some of the services. Oh, can you pop back just 1 second, Laura? Sorry, I'll try to do better.
No, I'm sorry.
No, it's me.
I was a little trigger happy.
So career resources, career readiness, counseling. They have up-to-date labor market information. So if you're wondering what jobs are kind of up and coming and what areas might be good to go into, like solar was the big thing for a while, and I think it still is. They can help you with that. So that might help somebody to get a job sooner. So next slide.
If we have any administrators or educators in this session, the American Job Center is a great place to make arrangements to bring your classroom. And it certainly has, they have a full menu every month that changes of classes that they're teaching, resume writing or coaching or various activities for employment. And I highly recommend that teachers visit. Again, it would be a full service American Job Center, but that would be a good transition activity.
Great, that's a great idea, Lois. And then this is the information about the CT Hires website where you would go to register. And then the next slide has the regional locations, and these are all full service locations. And then I believe that there are some smaller affiliate sites that are not full service. Okay, next slide. So for out of school youth programs, the Capital Workforce Partners is a program for youth 18 to 24. And they also provide access to training, skill building, so all kinds of different support for job seekers. They go up to age 24. There is a summer youth work program. I think, can't remember the name exactly. And that information is available on the CTDOL website, as well as the capitalworkforce.org website. Okay, I think we can go on to the next one. So the Department of Aging and Disability Services, also known as ADS, offers many services and programs. We'll focus on 2 tonight for our purposes, and those are the Bureau of Rehabilitation Services and the Level Up program, and the Bureau of Education and Services for the Blind also has a Level Up program. Ooh, fancy.
I didn't know that was in there.
I know. Of all the times we've been through this presentation, we didn't see that. So the Level Up program works with LEAs, which is school districts, lead education agencies, and there's a contact person for each school. So typically in the Level Up program, they're working within schools with youth that are still in school. We can go on to the next one.
I would just like to add that the contact for the Level Up program in each school, if you don't know who it is, it could be the nurse, it could be the teacher, and it could be the counselor, but typically there's only one Level Up contact per school.
Great, thank you. So the Level Up program provides supports and tools and information to students, again, who are in school, typically age 16 through 22, who have an IEP or a 504 plan. And they provide a variety of different services. So could be training in the school about job exploration, could be some counseling for what happens after students leave school, could be different work-based learning experiences, or job preparation and self-advocacy skills. So the best thing to do with regard to the Level Up program is to reach out to one of the contacts if you're curious about what's happening in your region, because different regions have different ways to deliver services. And so, Laura, if you want to go to the next, this is the coverage map, which is a little hard to see on my screen, but on the next, oh, wow, you are fancy.
Impressive.
Yeah, but the next slide has all of the contact information, and we will share the PowerPoint presentation because we know that you might need really a magnifying glass to read some of these. And if you need that information, you can also find it on the BRS website. So these are all. Oh, go ahead,
I will
Laura.
put the PowerPoint into the chat by the end of the presentation, and if not, you can just email and we will send it to you.
Great, thank you so much. So the next slide is about the Connecticut Pathways to Integrated Employment. So CTPIE, P-I-E, is Pathways to Integrated Employment. This is a pilot program. It's just in the second year. The first year was just planning. And this is a collaboration between the Bureau of Rehabilitation Services and the Department of Developmental Services to help people who are transitioning out of school to go into what's called competitive integrated employment. What that means is people go into employment in a similar way to how people without disabilities would go into an employment situation. And so what this pilot program is looking at is how can we help people receive competitive wages. And so what that means is instead of receiving wages that are below minimum wage, they would receive minimum wages or higher. And so this pilot program is looking at what do people need to be successful? How can we provide supports and services to people in a different way than we have in the past? How can we meet their needs and help them to go into jobs where they're earning minimum wage or higher? So next
And I
slide.
feel like it might be a strength-based competitive employment position. So always looking at the individual who may be a DDS consumer, Department of Developmental Services consumer, but have specific strengths. An individual with autism may have specific strengths, and employment would be around those strengths. It's an exciting opportunity to move from group supported employment, where you may have one job coach and up to 5 individuals with a disability and sharing that hourly wage, to an individual who works with on-off BRS support system. Once they get the job, they can always call someone and say, I'm having some trouble. Can we talk? Can you come in and help me work out a problem? It's an exciting initiative, and it's very respectful for individuals with disabilities who would like to be more competitive in their workplace.
Great, thanks, Lois. So here are some of the features of the CTI program. Right now, this is not open to just anyone. They're they've actually sent letters out to people who are exiting, so to family and individuals who are exiting district services. So last year, they sent letters to those who are exiting in 2024. So they, it is a little bit of a slower start, but the good thing is they're being very thoughtful and not saying we can take on everyone. And they are allowing a certain number of adults into the program as well, but they're keeping their numbers a little bit smaller so that they can learn step by step as they go along. There's a lot that they need to take into consideration, and so I appreciate their thoughtfulness about moving into this program. Okay, so the next slide contains the contact information. So if you have questions about the CTI program at this point, you can reach out to any of the people on this slide, and they're very enthusiastic and very happy to speak about the program. So if you have questions, I wouldn't hesitate to call them. Next slide. So Level Up services for deaf, deafblind, and hard of hearing students are administered through the Bureau of Education and Services for the Blind, otherwise known as BESB. And they provide the similar support, same supports as the level up program administered by the Bureau of Rehabilitation Services, but they can provide those services with supports using American Sign Language. And you will find the contact information as well for the counselors on this slide and the next slide, actually.
So the BESB is also for individuals in school that have an IEP or a 504.
Okay. Next is the Department of Mental Health and Addiction Services, also known as DMAS. And so they provide supports to individuals who are having mental health challenges or addiction challenges. They are not specific to youth with disabilities, but they do have a young adult services program. So they can provide sometimes counseling, recovery support groups, sometimes case management, sometimes assistance with housing or for people who are homeless due to mental health or addiction, and sometimes mentors and other supports. There is the young adult program, which is for people 18 to 25, is something that is, there's a referral required for that program. And so there's services and supports for youth, but it's typically youth who have been involved in the mental health system and can receive a referral. They have to have some significant hospitalization or have received some significant treatment. So the best way to go about finding out whether someone is eligible for the program is to contact them. Next slide.
I'd like to add that you can blend services with the Department of Mental Health and Addiction and BRS. Sometimes blended services are the best services for an individual. Some of these work very nicely together. For example, the Department of Mental Health and Addiction and BRS, oftentimes Department of Developmental Services, which we'll speak about next, and BRS. So it's not silos of services. I do want to point out that some of these are very blendable.
And I think we will see, we're coming into an era now where the federal government is sending out grants and things that require these organizations and agencies to work together. So we will see more and more of that as time goes on. Thanks, Lois.
So I'd like to speak to you about the Department of Developmental Services, often referred to as DDS because it's quite the mouthful. The mission of DDS is to partner with other agencies and individuals with disabilities and their families to provide supports. They have adopted the life course planning, so they are certainly looking for how to provide a good life for individuals with intellectual disability or Prader-Willi syndrome. The planning and development for services is after a diagnosis, and they're most interested in wraparound supports. There are some residential placements, which I'll speak about, day programs. They do have early intervention, family supports, respite care, and certainly case management. So let's talk about the eligibility. So you have to be a resident of the state of Connecticut in order to be a DDS consumer. You also have to have an IQ that is below 69 or Prader-Willi syndrome, a medical diagnosis of Prader-Willi syndrome. You must apply for DDS services before the age of 18. And if you already are receiving DDS services prior, so for a youth perhaps who is born and receives DDS services, you need to update your service I can't think of the name of it. I'm blanking out right now, but during the transition process, you need to not requalify, but oh my gosh, I apologize. I can't think of the name of it, but
Redetermination? Is it
redetermining. Thank you.
You're welcome.
Thank you very much. So you do need to redetermine. It's not a big deal, but it is part of the process in order to receive services after the age of 18. So typically a student may get a DDS diagnosis or services earlier. However, some families like to consider it just before graduation. This becomes a tricky situation if you wait too long, because there is testing and some needed documentation, and we'll go over that next. What I can tell you regarding DDS services that specific to transition planning is that I have often heard families or caregivers refer to life after school is that my child with significant disabilities will live in a group home. And it is, that is not the face of DDS these days, perhaps in the past. So if that is what you're thinking, I encourage you to go on the DDS website and see what may be available, or speak to your case manager to see what may be available. I certainly wouldn't want you to assume that a residential placement is in their future just because they have a DDS diagnosis or services. Also, I would like to say one last thing as far as eligibility. If you have a youth or a family member under the age of 18 and you're applying for services and they have autism as well as an intellectual disability, it is very important to circle both diagnoses on the top of the application, because the services for intellectual disability are different than someone with just an autism disability. So if they have a dual diagnosis, it's important at that time to indicate that they have both. Okay, so the application process is you can reach out to a transition advisor and you could request help from the helpline, which is the next slide coming. But this is a list of things. When I was saying you do need to do some mindful planning, because there are some information that you do need to provide in the application, which you can email in. It's not, you can scan or email it in. And if the student is below 18, you don't need to show copy of guardianship, but if you try to do it after 18, it muddies the water. As you can see, you need to show that you are a guardian or a conservator. So when you do get DDS eligibility, you get afforded between the ages of 18 and 22, you get a transition advisor, which will help you, should help you apply for Social Security, Husky C, and any of the other DSS eligibility things that your child who may not be working can qualify for. If you're under or either birth to 3 or in between or transition, they also have respite weekends and Camp Harkness passes. There may be family grants that you could apply for. All this information is available through the DDS contact information for the regional helpline, which is the next slide. Once you get a DDS transition advisor and or a case manager, typically individuals do not get a case manager until maybe 6 months before they graduate their school experiences. Sometimes they come sooner, but often not. It's towards the end. You would use the DDS regional helpline for all your needs. And here are the phone numbers.
And I just
They're
wanted to
very-
point out their, the eligibility unit, and also that's the email for the eligibility.
That's
So-
where you would email your application. Yep.
And I would highly recommend that, and keep copies of everything.
Oh, that's such a great point, Laura. For every agency that you apply for, that we'll speak to tonight and or forever, that you ever send in documentation, keep a copy either scanned on your laptop or in a file, because I can 100% guarantee you they will at some point lose it, and then you either have to reapply or you just send them what you already sent. So Social Security, they're all the same. They all say they can't find it. So keep it, and I would keep it for a good amount of time. Okay, thank you. So transition does begin at age 18. And that's when you would want to start to explore some decision-making options. The state of Connecticut is going to put forward, beginning in July, some information for families and individuals about decision-making. There is a process that can take place versus guardianship, and that is a very personal choice, families and individuals. We have many presentations on our YouTube site and our CPAC website about decision-making process. So I encourage you to look. If you think that you need to be the guardian or the conservator, that's when you would go to the probate court and you would find the criteria for those particular actions. And, you know, guardianship means that you are in full control of an individual, both financial, medical, and educational, and conservatorship is similar. The IQ is for guardianship is 69 and conservatorship is anything over 69. However, you know, we do encourage you to explore decision-making options other than guardianship. The case manager or the transition advisor will help you with Social Security, as I mentioned, and they will also involve you with BRS and Level Up. They will help get your youth or your family member a voter's application and hopefully a driver's ID or a non-driver's ID. Either way, an individual should have some form of an ID with their picture on it. And they should all be completed before the age of 21.
I just want to clarify one thing, that transition begins at age 18 for DDS, but transition in the school system begins at age 14. Just wanted to be
Yes.
really clear about that. Yeah, thank you.
Thank you, Beth. It is absolutely, that is a very good point to make. So types of supports that the Department of Developmental Services can offer is employment services, training for competitive integrated employment. We mentioned that. Individual supported employment, which means that the individual will work and there may be a job coach that pops in and out, helps them find a job, helps them keep a job. Group supported employment means that there is a job coach, typically provides transportation as well as support on the job. Pre-employment services could be things like assessments or aptitude tests. Project Search is something that is new to Connecticut, more or less. I mean, they've been around for a little bit. They're in various pockets of Connecticut. You could certainly find a Project Search vendor in your part of Connecticut. There are groups, day programs, so day supports. It's called Day Support Option, which is an individual who, to the best of their abilities, cannot maintain employment. They may just be recreational or for safety reasons be in a day support program. There's individual vendors that are paid by the Department of Developmental Services to support job search. So that's vocational. Then they have senior supports for individuals that are DDS consumers and over 65. And then to become a DDS or Department of Developmental Services qualified provider, you have to, complete all their information. And then if you're self-supported, which means that I don't want to get too deep in the weeds, but once you've been eligible for DDS after graduation, you get a certain amount of fiscal support, and you can either self-direct that support to a vendor who could bring you to jobs or pay for transportation or pay for the day services. So there's a list of qualified providers on the DDS website. So if someone isn't a qualified provider, there are ways to supplement them, but I encourage you to contact the help desk because they have all that information. So moving to just someone who has autism spectrum disorder, ASD, there is a waiver that is supported by the Department of Social Services. And so that is someone who has autism spectrum disorder without an intellectual disability. This is a wonderful program. It was a pilot about maybe 10 years ago. There is currently 1,800 people on the waiting list. It's a 10-year wait. So if you have someone with ASD and they're 10, you might want to get them on the waiting list for services so that when they're 20, they have a shot of getting some of the services that are afforded to them. Again, this is only for individuals with autism and not an intellectual disability. So the Department of Developmental Services has many resources for families around person-centered planning. It's referred to as life course planning. The blue links here will bring you to, the blue link saying charting life course will bring you to many, many tools. This is an example of one of the tools that can help an individual or a family do person-centered planning. It started in Missouri, I believe, and then about 13 years ago, I think now, they came into the state of Connecticut. The Department of Developmental Services is trying to explore more options in the community. As I said, they're getting away from group-supported residential programs, and they're trying to find resources in the community to support families that may be the caregivers. It is a wonderful tool. Many of the regional education service centers have family trainings. And I do believe at the end of our slide, you'll see a resource for CIRC. I'll point it out again. They have training and information on person-centered planning and charting a life course. If you have any more questions about that, CPAC does have several charting life course ambassadors. And I know that we're going to have a presentation in May coming up, the Transition Symposium, for a little plug. We can certainly get you that information. I think that I covered everything there. I did see a question, Beth, but is that something that we'll get to at the end?
Yeah, I think there's
Okay.
a few in the chat, so we'll
Excellent.
get to them.
Thank
So-
you. So this is another list of the agencies that we have mentioned so far. And these are hyperlinks to all of them. You hopefully, within the context of what we've shared with you this evening, you have a sense of which direction your youth or child may go, whether they may be looking for DDS services or BRS services, or you might want to get more information on the Department of Mental Health, but this is a stop point for this part of the presentation so that you can see that there are lots of resources for you. And if you have made notes to yourself to check these out, I'm proud of you because, it's a lot of information. And here is more resources. So the Disability Rights Connecticut is a wonderful, wonderful agency that I have certainly used myself. They brainstorm with me when I'm having a problem and they give me resources. I'm proud to be part of the Connecticut Parent Advocacy Center, which is the only parent advocacy center, parent center in the Connecticut that works directly with the State Department of Education to make changes and support families and youth. Connecticut Family Support Network is another wonderful agency that supports families. The Autism Services and Resources Special Education Resource Center is the CERC that I mentioned before. You'll see another slide, but they have a whole transition workshop. I forget what they call it, Laura. It's on their website, but if you're a transition person, you can just go to those resources. And the Office of Healthcare Advocates and the Surrogate Parent Program. See, I would have thought that was Surrogate Parent Program. So I guess it would have, I'm thinking Educational Surrogate Parent Program. So that's DDS resources. Best Buddy, Special Olympics champs. Connecticut is filled with lots and lots of social opportunities for people with disabilities.
Okay, really quickly, we do have a transition section at CPAC. Obviously, you're here for Transition Tuesday, so we do support and train families, youth, professionals, community members. And on our YouTube page, you'll see a lot of our Transition Tuesday trainings along with other CPAC trainings. I encourage you to check that out. And we do have a transition website, and it has information and resources and things for families. And I would encourage you to go there. And we're very proud to also have a student and youth page for transition. The youth team, they have created a lot of resources and around mental health, employment, just planning. And I encourage for everyone to go to that, because I think we're very proud of the things that they created. They're very, very youthful. And we do have our youth team. We have a youth advisory board, and I will actually let Lois speak to that because she is the contact person for the youth advisory board. Did I forget anything else about transition or webpage or? Okay.
So Secondary Transition Youth Advisory Board is the child of Beth Reel, who is on this presentation. As the CPAC transition coordinator, she went to many transition state meetings, federal meetings, regional meetings. And it occurred to her that all the educators and professionals with all good intentions were making plans for youth with disabilities without youth with disabilities. So she started bringing some, she created the Secondary Transition Youth Advisory Board and started bringing youth to conversations, and it has grown in an amazing way. We are proud that we are receiving new members all the time, and it is growing in a way that is directed by them. So I imagine that when Beth was bringing youth to the State Department Transition Task Force to make documentation understandable by youth, she didn't realize that if you fast forward a certain amount of years, they would be having their own social media page and podcasting and making YouTube videos, so that the information that is coming out around transition and the topics that are transition related, when they speak to the stakeholder, which is the youth, it is written and said in a way that they would understand. And so I am so excited that we have members who are interested in leadership opportunities in all sorts and sizes and all sorts of ways. So we just recently had a panel presentation at the Disability Summit at Mohegan Sun. We had 2 of our veteran youth advisory board members and 2 brand new members, and they worked together to share with the audience what self-advocacy and why it's important. And they did an amazing job. But we also have other activities for those who don't want to be in the spotlight, but they might want to write a blog about it, which you can find on the CPAC website. They could review state documents. They could weigh in and say to everyone, you know, this is it's too wordy. It's not in a way that I understand. We currently just did, I mentioned previously, there is an initiative around decision making. The State Department of Education is asking families and schools to consider decision making different than they have in the past. So the Youth Advisory Board had a presentation directed specifically for use, where they broke down what that concept means, and you can find that video on our YouTube channel. So I'm more than a little excited to be part of that.
Okay, this next slide has information about the Connecticut Medical Home Initiative. It is for children and youth with special health care needs. So children and youth who have any chronic illness, increased risk for illness, a developmental or behavioral or emotional condition that would require services above and beyond that of a typical child. So there are 5 regions throughout the state. And one of the entry points is through child development info line. It's like the point of entry for Connecticut, but you can call any of the regions and go ahead and refer yourself or talk to one of them. There is the contractor sheet right here, and it does break out the 5 regions. Family Support Network is one of the contractors who provide assistance to families. In favor, they provide the respite funds. There's a small amount of respite funds for families. And they do have care coordination services where they would do a needs assessment and they would help plan for the family, link them to resources and specialists, and help guide them through that medical piece. And they do some assistance through transition. And that is the contact information is Ann Jeanette. And again, you can look at the contractor sheet to go ahead and look at where your area is and who that medical home is. It's not, the medical home is not a person or a doctor. It is a model of service. Okay. DPH, the Department of Public Health, they do have a 5-year plan to increase and improve social emotional development of children and adolescents. Preventative health care, connections to medical and dental medical home, and all sorts of different supports for children and youth with special health care needs. And this is the information for the Child Development Info Line, where you can access the Medical Home Initiative also. But they also do other things, ages and stages, anything about development. If you have questions, you can contact Child Development Info Line.
And I have to say that if you were in a complete fog for the first 45 minutes of this presentation and you're feeling completely overwhelmed and you don't know which agency fits your family member or your youth, and all you have to do is call 211. That's easy enough, and they'll send you in the right direction. So it's a great resource for families. Even if you're having a moment where you don't know what to do next, 211 is a great place to start. Oh, our slides got, I'm going to take this one.
I think this was still Laura, right? No?
So the Department of Social Services helps with basic medical, Medicaid and Husky and health insurance, housing, food stamps, and cash assistance. There is a website that you can log on and create an account. I encourage you to transmit, if possible, your documentations through the portal. You can send it in, absolutely, that is your prerogative. However, I found it's more efficient if you can somehow upload them into the portal. The one thing that I can tell you about the Department of Social Services is they are timely and computer generated. So if a report is due, if you have applied for cash assistance or any of their assistance and they're telling you they need redetermination or they need updated paperwork, if you do not get it to them, you'll get kicked out again and you'll have to reapply. So I encourage you to always be timely with this particular social security as well, but this one, they seem to be really quick.
Yeah,
In my
they will,
experience.
yeah, that's been my experience. So I was looking for my unmute button and it wasn't clicking. So yeah, that they do have the housing vouchers through Department of Social Services, the Medicaid, the Husky insurance through Department of Social Services, and just go on there and look and see what you qualify. You can do a pre-qualifying checklist on their website to see if you qualify, but it does go along with the poverty levels.
And this is another area that the person that we're hoping to bring in around benefits will talk
Yes.
about, because there's a lot to it and it's complex.
Yes, then they have a lot of different waivers, like the PCA waiver. That's if you need a personal care assistant, or if you have a traumatic brain injury. So there's different waivers that you can get on so that you can get health benefits throughout the state.
Laura, do you happen to know what MedConnect stands for?
It's the Husky C portion of it, but it's from there's a and I don't want to get too much into the weeds. Department of Social Services, if you have a certain income level, they allow you to have a bigger income level, and also they'll look to see there's also if someone who's like institutionalized or needs a higher level of care, there's different levels on how to access the benefits and medical benefits that they would look at. I apologize, my cursor keeps disappearing, so I'm trying to get it on the screen.
Yeah, I think the order of the slides are bumpy because we just talked about 211 too. So
This is just another access, and it talks about the many services that 211 has. About healthcare counseling, for different programs for teenagers, for addiction, and it's just a one-stop.
okay, so Centers for Independent Living. So there are two different agencies on this slide. One is the Connecticut State Independent Living Council. They are the, I guess you could say, the planners of what the Centers for Independent Living will do and what the needs of the community around independent living for people with disabilities will be in the upcoming year. They also, the State Independent Living Council also did most of the work on getting the supported decision-making into legislation. There was a whole work group on that Laura was a part of, and they do a lot of advocacy, legislative advocacy, things like that. The Centers for Independent Living, there are 5 centers in Connecticut. You can find them. Are those 2 blue spots hyperlinked, Laura? They are, great. So you can go right to those links when you have the PowerPoint presentation. The Centers for Independent Living, like I said, there are 5. They each cover a region of the state, and their services are all a little bit different in each region. So it's worth taking a look to see what they offer or giving them a call and talking with someone. I do know that there is some funding that is coming about for Centers for Independent Living to increase their transition age supports for youth. And so more to come on that, because that's brand new funding that they probably don't even have the check yet. So so more to come on that.
Absolutely wonderful. And they do help folks who are in the transition age with different resources, peer mentors, and other things, so they can get involved. as young as 14, 15, 16. And again, as Beth had pointed out, the services are a little different for each independent living center, so give them a call.
Okay, so Oak Hill Assistive Technology is a wonderful resource around assistive technology and all kinds of supports that can help people to be more independent, enhance their quality of life. It's not just for people with disabilities, it's also for, well, elderly people who are experiencing disability. So they offer consultation, coaching, evaluation. There is information about trialing different products to help support people with disabilities, whether it's something in education or in the home. This is also a place where people can donate equipment. So if somebody's looking for something that may not be covered under their medical insurance, then they may be able to receive something low cost or free there. But also people that have, if somebody has passed away, you can call them and see if they are interested in receiving the equipment that you had. I can tell you that they do get an excess of equipment sometimes. So I have called them and asked them if they wanted certain things, and they have said, thank you, we really appreciate it, but unfortunately we can't. So vocational rehabilitation, BRS and BESB sometimes pay for evaluations with the NEAT marketplace to help people with employment. They do a lot of connecting with different agencies and organizations to support people, both in the home and in employment and other activities. Next slide. So the Connecticut Tech Act project is someplace that the NEAT marketplace might refer to if they don't have the equipment on hand. The Connecticut Tech Act project provides services to also support assistive technology. They can provide referrals for things like loans. So there's funding out there for some low or no interest loans for purchases of assistive technology. They also offer a loan program. So if they have it available, you can borrow it from them to see if it's something that would be helpful. This can be really very helpful and save a lot of money, because sometimes we think a piece of assistive technology would be real game changer for somebody, and then they get it and there's some glitch of it that doesn't work well, or maybe one brand has different features than another, and so you can find out what works best for you. So all of that information is available on the slide. Disability Rights Connecticut, Lois touched on a little bit earlier. So they provide advocacy and legal information about civil and human rights for disabled people. They provide a lot of information and referrals, so you can certainly call them and ask them questions about things that are going on. This is not specific to special education. In fact, they don't do a lot of special education work, but with regard to other areas in connection to people with disabilities, and I looked at their 2024 priorities, and they are around abuse and neglect. All of these are for people with disabilities. Abuse and neglect, healthcare, education is a piece of it, but it's a small piece. Employment, individual rights, opportunities to live in the community, and fair housing issues. And so the one thing that I I like to point out as well is they house the Client Assistance Program, which is also called the CAP program. So if you're working with a state agency, specifically BRS and BESB, I don't think DDS is part of the CAP program, now that I think about it, but I know for sure, we'd have to check that. BRS and BESB, if you are having challenges with them, then you can contact Disability Rights Connecticut and they can help guide you. I'll tell the parents out there that if you are supporting your family member, that they want to talk with the family member. And so you can provide supports, but they want to work with people that have some advocacy skills and can learn to navigate and advocate for themselves. And so the assistance is guidance, navigation, support. Sometimes they will call the agency and, you know, work with you and the agency to smooth things out. So that's something that's available for people who are in those programs. Next slide.
One thing I just wanted to quickly point out with Disability Rights Connecticut is they are hosting clinics for supported decision-making, and you can meet with a lawyer and go over the options, and they'll explain the whole process to you and pick out options that are good for you and your loved one.
And they were doing some IEP clinics at one time. I'm not sure if they have
I'm not
any
sure if
of
they're
those
still doing
on the
that.
schedule.
They were.
But I did see the supported decision-making clinics on the website when I was there today. So that's great. Legal services, statewide legal services provide legal services to people in Connecticut. Their services are free. However, there is a very specific eligibility requirement. You can imagine the needs for free legal services in Connecticut and everywhere are great at this point, and so they can't take on everyone. But it is, you know, if you are having challenges, it is a place that you can contact to see if they can help you. They will also provide referrals so that, you know, even if they can't support you, they may provide a referral. That would be helpful.
So what ties all these expectations together for our students with disabilities? Whether we dream of going to college or employment or recreational opportunities, or movies with friends, having a good life, and it's really transportation. So in the state of Connecticut, these are the state of Connecticut resources. In every region, there are subsidiary resources for people with disabilities. For today's presentation, excuse me, we tried to go more global. Let me just take a little sip. So for example, paratransit is mentioned and / dial-a-ride. Not every town has paratransit, but they might have dial-a-ride. If you go on the State Department of Transportation and find the resources for people with disabilities, there is an application that you can be certified as a person with disability, which automatically qualifies you for a reduced rate for wherever you want to ride. This certification may change the price of a ride from $7 one way to $3. When moving from school services, which is typically their teacher, transition coordinator, job coach, they drive you wherever you want to go. You come home, mom, dad, grandma, drive you wherever you want to go. Transportation is the one link that if we could say helps individuals with their independence, that would be my vote. There are also secondary transition, I don't know if you want to call them third transition resources, Uber and Lyft. They have, in my personal experience, I have a family member with a disability, have been very helpful. However, there's a huge learning curve and it does take some time and patience to figure it out. They have apps, but there are circumstances that happen that you just have to work through. So if the driver doesn't have good internet, etc., things can go a little sideways and you just have to figure it out. But I would encourage everyone. The Kennedy Center is a great travel training resource. Yes, perfect. Thank you. CT Rides, the Kennedy Center, they're great travel trainers. CT Rides at one point was actually offering gift cards for people who use public transportation. I'm not quite certain. I probably shouldn't have said anything, but for carpooling, transportation is the bottom line that gets people where they need to be. And when you leave school services, that, in my experience, has been the biggest barrier to success. So please take a moment to review these resources and see which ones may work for you, and contact them. Kennedy Center travel training is 100% free. And if a person isn't eligible or it's safe, then they certainly wouldn't move forward. But I would recommend checking this out. And I should also add that every bus system in the state of Connecticut is also wheelchair accessible. The driver education services through Easter Seals is a program. There may be folks that have a family member or an individual who would like to see if they can drive. And so Easter Seals does have an evaluation, and they do an assessment. They also have some kind of driver's test to see if it's possible. There are other Connecticut resources that teach individuals to drive with disabilities that I believe it's called Next Steps, but you can.
Next Street.
I'm sorry?
Next
Street
driving school.
Sorry.
Yeah,
We
okay.
didn't include that because
I'll put it in the
it's
chat.
not of the bigger, and it's not available everywhere. For this presentation purposes, we try to stay global, like I mentioned, for the state of Connecticut. But if there is something in Middletown, there's probably something in, thank you very much. There's probably something in Hartford. So just take a look wherever you live and see if there is a professional driving school that works with people with disabilities. And they do vehicle inspections too. As I mentioned before, there's some resources. So STIRT, the State Education Resource Center, if you go on their website, they're located now in Waterbury. They used to be in Middletown. If you're familiar with them, they are now located in Waterbury. They have an amazing library that you might want to take advantage of. Their book is online, so you can see if there's anything that is of interest. The State Department of Education and Special Education is constantly updating their website to make them 100% accessible. And they are located in Hartford. And Connecticut Parent Advocacy Center, Beth and Jane lead the way in New London, and we are there to help field any questions or resources for families and youth who advocate for themselves. And then there's, of course, the logos at the bottom of the resources that we have shared to date. We have discussed quite a bit, and I know that you're probably feeling a little overwhelmed. My hope is that at some point you wrote even some initials down, and if you get to the point tomorrow or in this moment when we open up for questions and answer, and you say, I wrote the word DRP and I don't know what it means anymore, just give us a minute and we'll figure it out together. So I hope you enjoyed this brief overview. It wasn't meant to be a full training, but it is meant to be a resource for you once you get the printed PowerPoint in your hands or online, and you can start making your own notes.
So several questions about the PowerPoint and the recording. So Laura will share the PowerPoint in a few minutes in the chat. And if you have any questions, or need that email to you, you can reach out to us at one of our emails. I'm going to launch the poll. Please fill out the poll while we're doing the question and answers. Let's see, what other questions do we have? Looks like Lois was popping in and answering some questions. Can CPAC help a family that has current support from favor? My favor represent, oh, okay. So CPAC doesn't represent families. So CPAC provides information and support. And so if you're working, I thought you said, I was thinking FAVAR, which is an organization in the northwest corner of the state, not FAVOR. So what happened in
right.
this particular situation, sorry about that, that was me, is yes, you're working with a person from favor, and so they should be able to answer your questions. And so we don't want to contradict what they are already doing or saying or helping to support you with. And so if you're working with an attorney or a certain organization, we may say that we're not able to, support you in that way. Sometimes there are quick questions we can answer, but that's more in depth. So
simple questions, we might be able to provide a resource, that sort of thing. When it comes to specific, PPT strategies, the favor advocate or the attorney or another advocate might have a certain strategy, and I might tell you to go in this direction, which will actually be counterproductive to what the advocate or lawyer or whoever you're working with is doing. But certainly simple questions or resources, things like that, we can answer.
Mm-hmm.
And I hope that clarified your question.
So let's see, what other questions do we have? So disability rights CT, is this for ADHD? Also, this processing speed of 72 and other comorbidities. So disability rights CT will take any calls and try to answer your question. They don't do advocacy. So if we're talking about a person in school, again, they might answer your question, but they're not going to come in and do some advocacy, but anybody can call them. They make a lot of referrals.
Right.
Any other questions that I'm missing, feel free to raise your hand and we can have you come off mute. There's a lot in the chat, so I am always afraid that I'm missing something.
Right.
Is
there anybody want to get unmuted? I don't know if we're muting people, or can we unmute folks?
Any other questions?
I see that there was a question in the chat that asked about the approximate turnaround time or waiting period time between applying and getting benefits. And I think, which benefits are you speaking about? That would be my question, because it depends on the agency.
In a generic form that typically you get on your response letter, you get the time that services would begin. So I did answer it, but in a generic way. So for example, we mentioned the autism waiver, the services could be 10 years, but that is an outlander to most services. Honestly, my advice, and this is a parent with a child with a disability, if you don't hear something, you just keep calling. Just keep calling.
All right, well, thank you all so much for attending. We know it was a monster of a presentation, and the fact that you're all still here and hanging in is, amazing. And please, pull the presentation out of the chat, because it is to be used as a resource to refer back to. Thank you, Lois. Thank you, Laura. Thank you to our interpreters. Good night, everybody.